In this week's Health Chat, I'm joined by Dr Michelle Harvie and Nicola Robinson-Greig, who are both from the Genesis Appeal, to talk about breast cancer subject with me now. Ladies, many thanks for joining us. Andy's brought news to us today of ladies in Accrington, 14 women being misdiagnosed of breast cancer. This will set fear in a lot of women. Is this common, people being misdiagnosed?
We can't obviously comment on that particular case. All we can say is that I'm sure the Trust is doing everything they can that's appropriate for these ladies, and if anybody is affected, I'm sure they have full support of a breast care nurse at the time.
And what sort of advice is going to be offered to these ladies?
They will obviously have full screening. Any diagnosis that's been missed will obviously be talked about, and they will have a new diagnosis, and obviously, again, with full support.
So you mentioned the screening there. What does the screening actually involve?
Well, breast screening is for ladies at the moment aged from 50 to 70, and that's when they're invited along for a mammogram to make sure that they haven't got breast cancer. And if they have, a diagnosis is made and treated. Actually, breast cancer has just been, with the screening programme, it's been extended to 47 to 73, and that'll be coming in the next few years.
So does that mean ladies of, say, my age, late 30s, we shouldn't bother about it? We just wait until we're asked to come in for a test?
No, not at all. You won't be offered a routine mammogram as part of the breast screening, but it's important for any lady to be breast aware, because obviously early detection is paramount in breast cancer. So ladies such as yourself should get used to touching, looking and feeling your own breast to make sure that there's no problems or anything new that's arisen.
So that's the key, isn't it? Is if you do it on a regular basis, then you'll know when something new is there.
Absolutely.
However, if you don't do it for 4 years,
you won't know what's new.
You won't.
It's about making friends with your breasts, making sure you know what's normal to you, and then you can identify what's new.
OK, now, Michelle, I'm going to bring you in here because actually breast cancer is very much going to be in the forefront of our minds, because it's going to be featured on Coronation Street. Yes. One of the characters, Sally Webster, is going to be diagnosed. Yes. It's quite a frightening thought, and it's great that they're bringing it to the forefront. How are they going to deal with it as a character?
Well, we're really pleased, actually, at the Genesis Centre that Coronation Street have decided to, report this story responsibly, and they've come to us to seek advice about how to make sure it's an accurate description of a woman's experience of going through breast cancer. I mean, Sally Webster is one of 46,000 women in this country who are diagnosed each year. Breast cancer is on the increase, and at the Genesis Centre we're trying to do a lot of work trying to reduce risk and trying to do some work about prevention. Why
is it on the increase?
There are a number of factors. There are hormonal factors, things like people having children later. There are probably a lot of the factors that we particularly are interested in terms of the increasing problems of weight, lack of exercise, dietary factors as well, are probably part of the reason for the increased risk.
Now, that's very interesting, because I just thought that breast cancer was something you were either going to get or not get. Are you saying that it's preventative?
We think that for a lot of people that we can reduce their chance of getting it. Some women have a genetic predisposition, but even those women can reduce their chances by adhering to sort of healthy lifestyle factors. But the important thing is that women who've been diagnosed shouldn't try and attribute blame to themselves, and probably moving on from that moment in time and trying to look at healthy lifestyle, we know really reduces the chance of breast cancer coming back. It's really important for breast cancer patients, and we're doing work for that as well down at the Genesis Centre.
And how important is aftercare and family care if you are diagnosed with breast cancer?
It's extremely important. For a lady to cope with breast cancer, life goes on after treatment and after breast cancer, but it never goes away, the psychological impact of things. So the support that they get at the time is so important for how they cope long-term for the rest of their lives. And that's not just for the patient, it's for the husbands, for their partner, and for the whole of the family. We know, like in Coronation Street, Sally's got 2 daughters, and obviously they will be impacted, not just because mum's got a diagnosis, but as Michelle said, because they might have a genetic disposition to it. It's very important that it's done sensitively.
OK, well, thank you very much indeed. I'm sure that Coronation Street will cover it sensitively. Ladies, thanks very much for joining us.
Thank you.